going to save you sitting down and getting back up. I'd like to bring the meeting of the Hudson Valley Regional EMS Council, February 21st, 2024, to a opening. If we could stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, before we call roll call, we received a couple of letters changing delegates and alternates. I want to read those into the record so that their vote this evening can be counted. We have a letter from Putnam County EMS dated today, stating that the Board of Directors, Putnam County EMS Council, has voted Martin Miller as an alternate delegate to the Hudson Valley Regional EMS Council. He will be replacing Sarah Baker. And then it's signed President David Jacobson. We have a second letter from Rockland County dated today. To whom it may concern, please allow this letter to serve as confirmation that Rockland County EMS will be removing Teresa Hamilton from her position on the Regional EMS Council as she has retired and relocated to South Carolina. And in turn, we will be appointing Allison Spong, did I pronounce that right?
Yes.
To fill her term.
Can you spell that for me, Dave?
Sam, Paul, Ocean, Nora, George.
Thank you.
You're welcome. And then we have Allison's contact information here to read into the record. Okay, is there any other changes that want to be submitted? If not, we're going to ask Steve to go ahead through the roll call.
Okay, Dutchess County, Chrissy Amy, Dave Violante, Joan Siebert, Anthony Sang,
Here.
David Jensen, Stephen Scully Beeman,
Here.
William Marshall, Orange County, Michael Biggs,
Here.
Rich Haley, Wayne Chen, David Grass,
Here.
Israel Nabla,
Here.
Frank Cassanite, Michael Wachowski, Nancy Pfeiffer,
Here.
Putnam County, Bob Cuomo,
Here.
Dave Jacobson,
Here.
I am here, Mike Mikulski,
Here.
Nicholas Falcone, Martin Miller,
Yes.
Rockland County, Denise Garati,
Yes.
Nick Rizicki,
Present.
Tim Egan,
Here.
Desiree Leon,
Here.
Glenn Alvin,
Present.
and I didn't get the last name, the new alternate Allison,
Allison Spong. S-P-O-N-G.
Ephraim Tober,
Here.
B.J. Leitner, Sullivan County, Albie Bachman, Alex Rao,
Here.
Neil Meadow,
Here.
Norman Prentice, Jeff Ashdown, Sean Lewis, Ulster County, Richard Parrish, Kelly Nelson,
Here.
Karen Pardini, Matthew Goodnow, Austin Heller, Cody Carroll.
Is there anybody that is present that believes they're on the council, either as a delegate or an alternate, that was not called? Seeing none, just confirm we have a quorum, sir. And if you could, just let us know who is eligible to vote. Let's see, we have alternates and delegates.
So for Dutchess County would be Anthony Sang, Stephen Scully Beeman. So those are the only two as the alternate. And Nancy Pfeiffer is here, right?
Yes.
So can vote as an alternate.
Okay.
And And of Sullivan County, no, that's it. No. That's it. So we have a quorum.
Thank you, sir.
But
All right.
hold on, you have a few people that are here that can't vote. The alternates for Putnam County can't vote, which is Mike Mikulski and Marty Miller.
Right, for a vote, I would only call out those that can.
Okay,
That's where.
just so that they know that they can't.
Right.
And then Ephraim Tauber and BJ can't vote on Rockland. Otherwise, everybody that's here can vote. That was called.
Beautiful. Okay, thank you, ladies and gentlemen. What we'd like to do is we're going to move the agenda up for the ease of the stenographer. Under new business, under the agenda, we have the Carmel Vac expansion of territory vote. So what we'd like to do is move that to the front of the agenda at this point. Glenn, if you're ready for your report.
Yep. So we have a second in motion that's gonna come before the council on a request from Carmel Volunteer Ambulance Corps to expand their territory into Mayapack and Mayapack Falls. We had a hearing, what was the date, Bill, again, for the hearing officer?
I gave you.
I got it right here. Let's see.
January 8th.
January 8th, yeah. So it was held, we received it back, I think everyone was sent it. We have a second in motion. I'm just going to read this into the record. The Transportation Committee met on 2/12/2024 to discuss Carmel Volunteer Ambulance Territorial Expansion into Mayapack and Mayapack Falls. We only received one letter in opposition to the expansion. It should be noted that Putnam County contracts for one ambulance 60 hours a week for one ambulance in a county that is 250 square miles and a population of approximately 100,000. The discussion centered on the need for expansion. We determined that Empress Ambulance has a contract with the County of Putnam for an ambulance 60 hours a week from 8 a.m. to 8 p.m. Monday through Friday for the entire County of Putnam. If the proposed expansion is approved, a second ambulance from Carmel Vac will strategically be positioned in Mayapack and Mayapack Falls to provide decreased response time 24/7 to the emergency calls in the expansion territory. As in the hearing officer's report, the town of Carmel fully supports the proposed expansion. Presently, the contracted ambulance is only covering 36% of the weekly clock hours, 60 hours versus 168 hours. This asset is utilized throughout the county and is sometimes not available to cover the proposed expansion area. Information provided to the Transportation Committee indicated the county is unwilling to contract for additional time from the contracted entity. Information from Putnam County EMS Council had a vote to support the expansion of Carmel Vac expansion in early either November or December 23. A roll call vote was taken, and Empress Ambulance, who was a member of the council, voted for the expansion. Out of the 820 calls within the expansion territory, 51% of the calls were when Empress was not on contract. This demonstrates need for expansion. The other 398 calls in the expansion territory, 128 calls were going on simultaneously when the county contracted Empress was out on other calls in the county, making them unavailable for response to the expansion territory. This further demonstrates the need for expansion. The committee took a roll call vote at that meeting, and we voted unanimously to support the expansion. And a quorum was present at that meeting. So it is a second in motion.
Okay. Let's bring a second motion to it. Is there any comments or discussions about the Transportation Committee's report?
Thank you for your work.
Okay. Thank you for the detailed report. We appreciate it. Okay, before we take this vote, is there anyone that wants to declare a conflict of interest in this vote?
I'm the chief of the agency, so.
I'm sorry, I can't hear you.
I'm the chief of the agency, so I have to remove myself.
Okay, so you're gonna declare a conflict of interest?
Yes.
Okay, very good. Is there anyone else that wants to declare? Is there anyone in the council that's eligible to vote that feels that someone who has a conflict of interest should declare a conflict of interest? Hearing none, as the president, I'm going to withhold my vote unless there's a tie. Is that fair enough? Okay, we'd like to go for a roll call vote, please.
Dutchess County, Anthony Sang.
Yes.
Stephen Scully Beeman.
Yes.
Orange County, Michael Bid.
Yes.
David Grass, you're holding for the close to, right? Israel Knobloch.
Yes.
Nancy Pfeiffer.
Yes.
Putnam County, Robert Cuomo.
Yes.
David Jacobson, abstaining, right? Steve Wygan, yes. Rockland County, Bernice Grotti.
Yes.
Nick Rozicki.
Yes.
Tim Egan.
Yes.
Desiree Leon.
Yes.
Glenn Albin.
Yes.
And that's it for Sullivan County, Albie Bachman. Oh, sorry, Alex Rao.
Yes.
Neil Medow.
Yes.
Ulster County, Kelly Nelson.
Yes.
Passes.
Okay,
Oh,
just
yes.
confirm that 51% of the eligible voters voted for yes.
Yes.
Okay, and the motion carries. Is there anything else that we have for the stenographer? Thank you very much for your services. Okay, let's get back on the agenda. Very good. Thank you, everybody. I appreciate everybody showing up. Can we get an approval of the December 2023 minutes, please? Or any corrections, modifications, additions, subtractions? I'll take a motion to accept them. Alex Rao has a motion, and Anthony is going to second the motion. Any comments? All those in favor? All those opposed? Nobody abstaining? It's the motions. Good. Thank you. All right, Vice President's report. You have it in front of you?
No. I have treasurer. So you have vice president?
Hold on, we have it.
It's here. I got it.
I didn't know if you had printed it. I have it in writing. Have you got it?
Yeah.
Okay. All right, so we'll minimize that.
I don't know. These two. I don't know if you want this.
What's that?
I hate that infectious disease thing.
Okay, Rich's report, Vice President. First of all, he apologized for not being able to be here, but he had the audacity to enjoy some quality time with his wife. He represented the council at the following events: the Lower Hudson Valley Hospital Mutual Aid Coordinating Entity, the Hudson Valley HEPC meeting. Any idea what that is?
Healthcare Emergency Preparedness Coalition.
Thank you very much. Just one more time, Michael.
Healthcare Emergency Preparedness Coalition.
Outstanding. He represented EMS as a member as an infectious disease tabletop, covered lack of EMS resources when decision was made to decompress the hospital, and an after-action report is attached. It's up here if anybody would like to see it. He attended the helicopter meeting, REMAC meeting, Transportation Committee meetings for both the Carmel CON, and we have an application from Blue, am I saying that right?
Blue Care.
Blue, it says Blue. Blue Care, which is a CON expansion. That one is not ready to come before the Transportation Committee yet, so that one will be coming up. I apologize for this jumping up. That happens when you lean on your computer. So, Protocol Committee, Training and Education meeting, State HVREMSCO meeting, and the Ulster County EMS Council meeting. A couple of things that Rich brought to the table. We will distribute it on Boardable shortly. But if you remember, we had a couple of new committees that we wanted to form. And he wrote their primary job responsibility out for it. Those committees included the role of the Audit Committee. If you will remember in the last meeting, we discussed the fact that as part of our regulatory requirements, we need to have an audit committee that is regulating that we go through there. He is clearly defined, and I'm not going to read these now, I'm going to put them up on Boardable for you guys to be able to review so that we can vote on them in the May meeting. The role of the Public Information and Education Committee, the Conflict of Interest Committee, the bylaw is modified to add 2 new EMS-orientated people. So again, that's here if you want to see it tonight, but we will upload that shortly into Boardable and you'll be able to review it there. Is there any questions for the Vice President? Make them short. Okay. Hang on, I'm just pulling up my stuff here. So, just give me a second here. Okay, President's Report, because I'm going to have to look at it here. So, first of all, I appreciate everybody's participation this night. This is a great turnout. Thank you very much. It's February, it's not snowing, it's actually tolerable weather. But what would be really great is if we knew you all were coming. So, one of the things that helps with that is when you mark in Boardable, and is there anybody in here other than Kelly? Because you indicated that you're having trouble accessing Boardable. Is there anyone else that's on the council, either as an alternate or delegate, that hasn't been able to access Boardable? 2, all right? Have you tried, Michael, and you can't get in, or you didn't know you had access to it?
Reset the email was different than what we use.
Okay, so maybe we can work on that this evening, but at minimal, we want to get up. Steve, you're in the same boat?
Yep.
Okay, because what happens is, by you guys marking your attendance here, we don't have to panic whether we have a quorum or not. So it just really makes it easier. Equally, what we're trying to do is slow down on the number of paper that we kill. Since everybody creates their reports electronically, we're uploading them now to Boardable. So the minutes, reports, everything that you'll see. So if you go up to Boardable now, you'll see my reports already posted and up there for that to work through. Steve's will be up there as soon as he gets it typed out. That'll go up into there. The treasurer's report will be in there. So that you'll have access into this stuff. One of the things that we discussed this evening, we had an executive board meeting a little while ago. We're going to see if we can start creating subgroups inside Boardable so that the transportation committee can work remotely, especially when they have large files to review amongst each other, so that we can do that all inside Boardable. And the great part about it is we believe we can, we're gonna confirm it, that we can create a subgroup inside Boardable that would only have limited access. So if you're not part of that committee, you wouldn't be able to get in there and see what they're working on until they come out with their final reports. But again, we just looking for, and you will see that I threw up, and once this report's down, I'll bring it back up. I have the spreadsheet of everybody that's on the council. We want to make sure that your emails are correct, and most importantly, make sure that your committee assignments are up to date. So these committees are important for the work of the council to get done. We need participation. So we're just looking for it. If you'll recall back, you guys voted to change the bylaws mid last year, where every member, regardless of whether you're a delegate or an alternate, has to serve on a committee. Okay? And some of those committees meet quite often, some of those committees meet once a year. So again, all we're looking for is participation in that level. So that's really the Boardable initiative in there. I have reached out to Westchester, and I'm having difficulty speaking to them. I did meet with Brett Roberts up in council, and he's willing to help me try and get it through. But there's money available through the economic development regions, and the Hudson Valley and Westchester are in one group. And what we're looking to do is see if we can tap some of that funding to be able to use it for initiatives here that the region's working on, especially some of the new committees that we're working on for before. All right, again, I have the bylaw changed. Tim, Albie's not here tonight, so I'm assuming you're,
Correct.
so
I
that
don't
should
have
be
it.
able to come to vote. I have it for you.
Good.
So, if you would like to, when we get to your portion, we'll put that in and then we'll take it to a vote. Can you just send that along there? But what we'd like to do is get that amended in. And essentially what that's going to do, ladies and gentlemen, you notice that before the stenographer left, I had to ask, did we have 51% of the eligible voters? Every time something gets appealed, not every time, but a significant portion of time, something gets appealed at the state level, it's because somebody appeals that 51% of the eligible voters didn't cast a positive vote. So our bylaws fell into that same loophole. So what I had asked the bylaw committee to do, which Albie and Tim worked on and the language was presented last meeting, was that we change our bylaws that we only have to meet 51% of the voters present for something to be carried through our bylaws. This way it takes that loophole of an appeal right out. Because the last thing we want to do is have an opinion of this council voted on and then have it appealed through a technicality loophole. So we're just trying to eliminate that so that we're staying proactive on there. So hopefully that'll get that finished this night is when we go through. Conflict of interest members, Rich is not here to tell me where they're at, but just for my own, did anybody sign up for that committee? It's one of the no-brainer committees. And essentially what you have to do is once a year, once we have elections, is make sure that anyone that sits on the executive board doesn't have a conflict financially into the organization. Nobody does, but by state regulations, we're required to have a checks and balances that we're, making sure we don't have a conflict of interest. So again, later on you see that you don't have a committee assigned to you. That's one of those committees that we could really use somebody on when it was coming through there. Yes?
I'm not just clear, like, what is involved in that? I mean, I understand what you just said, but, like, how do I know you don't have a financial conflict?
That's going to be for the committee to decide whether there's I don't know if you're going to be doing state police background checks. I find that hard to believe, but we did draft out a guideline for that committee. It's up here that we'll upload to Boardable of what we envisioned that would look like. And again, please understand, guys, these are all things that come back regulatory through the auditors. Because we are a not-for-profit organization, we do take state monies. We are obligated through all of the rules and regulations through the comptroller's office to make sure that we have all of these checks and balances, that we're not, having a conflict of interest. I don't know how you define that, so.
So
Yes, Desiree.
I've gone to a couple other boards and we use a form that's been provided by the auditors, where you just declare or not declare your relationship with the organization. I'd be happy to send those along to the committee. I don't want to be on the committee.
Yeah.
But I'd be happy to send those along to the committee.
Not a problem.
They could use as if they don't have something to start with.
So we were aware that, each one of the executive officers would have to sign, a non-conflict of interest form, but then we need an independent body to look at those and make sure that we're actually telling the truth.
So, yeah.
Because I fibbed. Yes?
Ephraim and I would like to be on the committee.
Okay. Is somebody taking that note, Steve? Remember who it is? Okay. Did Ephraim actually voluntold or?
Denise offered to chair it and I said I'll help him.
Okay, perfect. All right, so Steve will make sure that he gets that through.
I got it.
Because they're gonna make sure that you don't have a conflict of interest. So not a problem. So one of the last things that I'm working on as the president is, we have been talking for a long time of recruiting and retention, right? Those two words have gone synonymous or hand in hand with each other. I don't believe it's true, okay? And I'll tell you why. I watch the number of people that are being put into EMT courses that score EMT cards, but yet we still complain that we have recruiting problems. We're training them. The question is, where are they going? So to kind of deep dive that, while I was at state council meetings, wrestled Alex to help me with some of this data pulling up. And Alex Blue is really phenomenal when it comes to data mining. And one of the difficulties is this comes out of two different databases. So for 2019 and 2023, I have asked him to tell us how many providers were certified in those years in the Hudson Valley. So regardless of whose core sponsorship it was, whether it's a municipal agency or a volunteer agency, how many were certified? And in that same year, for 2019, how many people show up on a PCR for an agency in the Hudson Valley today?
Isn't the number statewide like half?
We don't know what it is, right? So I asked him to do 2019 and 2023. I just decided I'm gonna whitewash the COVID years, so that there's no skewed numbers, right? So we should be able to look at 2019 and 2023. How many people did our core sponsors in the Hudson Valley train in those 2 years? Equally, how many of those people are showing up on one PCR in those years? Because I truly believe, and you can tell me I'm wrong and I'm living in a cave somewhere, we don't have a recruiting problem, we have a retention problem. We can't hang on to people. So, in anecdotal information, we start bouncing things along on the training committee, and multiple core sponsors will come back and say, half my class was going on to be firefighters. They were only taking the class because they want to be career firefighters, which is great for the fire service, but it's not doing anything for our EMS service. So if we can identify that and really put something in it, then we can come back and say, okay, this is our target. How do we find it? It's what I'm working on. Maybe it will turn out to be fruitless, but I didn't want you to think that I was just sitting around, not looking pretty. But that's kind of where I was going. Any questions for me? Comments? Am I on the right track? Am I way off base?
Just
Go ahead, Nick.
what Anthony said, the state did come out with half of the people certified to appear on a PCR in a 3-year period or something like that. There was something like that
Right.
they did come out with. But I think
We'll look at it. We'll look at the data, we'll crunch the numbers, and we'll see where we go from there.
David, could there be a difference between core sponsors that actually have their own EMS versus core sponsors that are like schools, like BOCES and colleges and stuff?
So what we're pulling the data from is any course sponsor that registered a course and said that they're gonna be teaching that class in the Hudson Valley.
No, I know, but can you drill down the data even more to look at which of the folks that don't show up on PCRs were core sponsors that have ambulances versus which ones that don't? I mean, I'm kind of wondering, and I'm not making any accusations, but I'm just wondering, like, if you're teaching a class and you have the ambulance right there, I mean, that may be more.
I totally understand. That'll be an interesting look. I guess we can deep dive it. When you get the report from Mr. Violante, who couldn't be here this evening because he was teaching, you're gonna find out that we're a little disappointed in some of the data that we're receiving on the iGel program. And it's unfortunately casted a little bit of a gray cloud on how much of our actual data is legitimate data. So that'll be something great to deep dive when we start seeing the numbers. It's taken Alex a little while to build these databases because it's coming out of 2 different programs. So hopefully it will get there, and yeah, maybe we can look at that and see where it's at.
Yeah.
So, anybody else? Tim?
So I understand, obviously, training and course sponsored 1923, but in the bigger numbers with providers showing up on PCRs, is that data not a little bit skewed until about 2025 because we all got 2-year extensions through the COVID years? And, so are there people that got extensions that shouldn't even be EMTs, or they had left? I'm just.
It'll be interesting to see what the data rules out. And
necessarily.
again, we will have to deep dive some of that information and see if there's outliers in that data, that skews some of the information. But until we start looking and crunching some of the raw numbers, we really don't even know what we're looking at. I mean, please correct me if I'm wrong. Do you have more than enough providers? Okay, I don't, okay, Michael is, all right. But we all don't have Michael's award-winning personality, so, you know, that's. Yeah. So we end up with a situation where, you know, we're all looking for more providers, right? Some are doing a better job than others. But I truly believe that we're losing people as fast as we're putting them in. We have a hole in the can, and we're putting people in at a pretty good rate. We're just not keeping them on the other end. That's just a theory I have. We'll prove it with numbers. The great part about it is the state's willing to work with us on data. So when we start deep diving some of this stuff, when we bring it back and you go, well, what if? Then we'll ask them to tweak those numbers a little bit. So that's kind of the nice part about getting those raw data to kind of go back through there. Anybody else? Chris. Chris,
I just know as being a provider, having been in the street and, you know, worked with you for a number of my partners came to me, and one of the things after about 3 or 4 years I would say to them would be like, why did you become an EMT? And most of them would come to me and tell me because I need patient contact hours to get into nursing school and to be, or go to, you know, nurse practitioner. So that's another avenue of things to, you know, when I'm trying to invest in making a provider of somebody that's, you know, trying to keep them, like, what is it, you know, why is it this such a thing? So, but that was just what I encountered as a provider, you know, over the years.
Yeah, I mean, I think it's known that EMS is a stepping stone towards another profession. I mean, EMT specifically, but, you know.
All part of what we need to figure out how to fix, right? How do we get people to want to stay here? And there was a time where, you know, it was, we'll pay them more.
Can we associate the data that we're pulling with registered nurses or licensed PAs or licensed NPs or licensed physicians? We have some amazing young EMTs, some of whom sit on the REMAC, that are now physicians.
Sure.
Is there a way to correlate that? I don't even know.
I would have to ask somebody far more familiar with the databases of whether that could go, because I know that would now leave the Bureau's database and have to go to the Department of Health's database.
Education.
You know?
Department of Education.
Right,
Division
so
of Licensing Services.
God knows they're easy to work with.
Oh, sure.
Go ahead, Tim.
So I think what you're gonna discover and what will be very interesting to see is something that Steve Kroll brought up at HVREMSCO, I think it was back in September, with regard to the retention on the 5-year look back.
Correct.
And 19 moving forward will be interesting. Because I think that spread is gonna be very important. As you said, we're losing more than we're gaining. But the other thing we have to consider is the total number of providers as a percentage of, or the total number of providers in Fidney as a percentage of all the providers.
Sure.
That's a big number.
And again, maybe we're losing a significant portion of our providers to Fidney.
Exactly.
You know, so again, I don't know until we start looking at data.
ALS versus.
Go ahead, Michael.
So my question would be, we get the data, we know they're leaving, but then what agencies are holding on to the providers and how are they holding on to the providers to see, all right, are you mandating weekends, are you mandating this shifts, what works for some agencies and that works for other agencies, and that's how you're gonna see like how we maintain or retain our employees versus another service that might have higher costs for health insurance.
And you're exactly where my thought process was, because that's page 2. Once we have the data, what agencies are retaining their people and why, right? And what can we do to replicate that in other organizations?
So what problem you're trying to solve, right?
Right.
With data, so what's the problem we're gonna solve and how we're gonna solve
Right.
it.
So that's kind of like page 2. So that's a great way to start to think about, you know, what this data can show us and how we work towards, you know, fixing our own problems, because one agency may very well have solved the problem. Now we have to figure out whether we can replicate that in another one. Go ahead, Desiree.
So to jump ahead, I don't know what we're called, the Recruitment and Retention Task Force, I'm not sure what we're called. We've just developed a survey that's gonna go out to all of the agencies. And it's gonna ask some of those questions. We try to keep it kind of simple, so that people will take 5 minutes to actually do it. But it's gonna ask some of those questions about things that are working for them, their top 5 priorities in recruitment and retention, what, you know, was concerning of them, to them, and we try to make it as drop down as possible, so they're not having to type in anything, and
Excellent.
they'll take the time. So I think we gave everybody ample time in the committee to review it. I don't think there's been any changes, so.
Okay,
I'm gonna
well,
have
when
a
you guys are
QR
ready,
code.
let us know.
Yeah, I have a QR code that I'll attach to it,
Beautiful.
so I'll link right to the QR code, and we'll have Bill distribute it out, and then we'll follow up with the county coordinators to, you know, really
So
drill
in,
it down to every agency in every county.
so in my mind, these initiatives are exactly why we come to these meetings, right? You could watch the state meetings and get state reports out of it, but the ability to be able to network, the ability to be able to help our agencies back in our counties is what we're here for. So I love it, absolutely love it, and together we're gonna make this work. Any other questions for me? Go ahead.
With respect to both volunteer and career agencies, do you do exit interviews with folks that are leaving, or is the break so contentious that that's not a possibility? And if it is contentious, why?
I think people want to progress though. We become CPR trained EMTs, paramedics, we want to go to nursing school. I think we're in a business that's going to have people go through the ranks, and that's going to be normal. I don't want any of my providers to stay with me for 5 years as an EMT. I want them to become a paramedic, come in management, or do something else, because no one can live off the medic wages we're paying. So we should want our employees to leave eventually, or become part of the organization structure.
And that's good, but if we don't have the data on that side of it as to why people are leaving, then we're looking at only half the equation, which is going to remain unsolvable. So if you're leaving to progress career-wise, keep that data.
Guys, I absolutely love the comments here, because this is exactly what we need to be doing. I just think that we can do these in committees, right? So thank you very much. I appreciate you guys, input, because we'll fix this together. I don't think no one agency is going to fix it by themselves. So, Treasurer's report, please.
Okay, since our last meeting, we've written 22 checks for a total of $16,077.71. The same on the rent and miscellaneous payments, including water, internet, email, and mail, and supplies are where all the expenses are. Details are available from Wayne if anybody is interested in them. There was only one transfer that was from the program agency account to the payroll account for $30,000 done in January 31st. There's been no deposits in since the last meeting. And right now, we have 2 vouchers outstanding, which were just recently submitted. They're for 12/31/23 for $56,185, and the council one is for $4,677. We have one old outstanding training voucher that must have got lost somewhere. I resubmitted it in February 1st, and Drew Chesney from the Education Department is trying to track it down. So we'll see what that, but that's only $560. At this point in time, we have a total of $207,169 in our treasury.
Any questions for Bill? You want to roll right into
Sure.
staff?
February 5th, 6th, and 7th was CMAC and HVREMSCO. It was in person in Troy. There was a quorum on the REMAC side this time, so all that business was taken care of, because if you remember the last time there was not. And most of the topics I think we're going to cover. Well, I don't know how you're going to do Dave's report.
What's that?
I don't know how you're going to do Dave's report on
I'm
this
going to
one,
upload it into Boardable, and everybody's going to read it.
Oh, okay. So I just went over our general financial picture, so that's pretty much the same. Our current contract, now we have 2 contracts. We have a contract for the regional council and a contract for the program agency. The current contract expires on 6/30/24, so we're in the middle of, well, we haven't actually started, so we're not in the middle. We haven't started, but we are going to start very shortly discussing the 7/1/24, and it looks like it's going to be a 5-year contract. So that's going to make things a little bit easier and go through things. We're hoping, we have very high hopes that the contract will reflect some kind of an increase on the program agency side, so they get more money. The program agency has been stagnant, or both the regional council and the program agency have been stagnant since 1998. So it's been a long time since we've had any kind of an increase in that. So hopefully we will get something on that. It looks pretty promising at this point. The regional council will not get an increase, and that's kind of because regional councils get $25,000 in their budget, in their grant, and they're not going to increase it because if it goes over that, then they have to do an audit. So the audit, because we're regional council owns the program agency, we just do a single audit and everything's included in it. If you were an agency that the regional council didn't own the program agency would have to do the audit, and then the regional council has to do their own audit, which could cost you anywhere from $5,000 to $7,000. So they felt that that was not a burden that they wanted to put on regional councils, giving them a $5,000 increase and costing them $7,000 to do an audit. They just thought it wouldn't work out so well. So they decided to put all the extra money that they're going to put into the program agency that already is required to do the audit. The whole process, our whole financial process used to come through Grants Gateway, and on January 6th of this year, they moved it over to the SFS, which is the state financial system. It's a lot better. It looks better at the point from the studying I've been doing with it, but we were familiar with the Grants Gateway, so we had to move everything over. So we're working on that now. Hopefully we'll have that done by the end of this quarter. The collaborative protocols change, the collaborative protocols are being updated January 1st of every year. Since there was not a REMAC meeting last month, they didn't get them approved, so they were approved at this last meeting in February, which means that, but we're still going to try to do an implementation for July 1st. Now, the protocols are going to come out, they're going to have a change log with them, they'll have some education associated with them, and every agency is going to be required to bring their people up to those new protocols by July 1st, and that's when they'll go into effect. The Bureau of EMS hasn't published any new policies since our last meeting. HCS hasn't changed. They haven't done anything with that yet. Tonight we voted on the Carmel volunteer ambulance squad to Carmel, to the entire town of Carmel. We have another application that's been in for a new ambulance corps in Rockland County. It was deemed, last night we had a meeting, and it was deemed incomplete. We're sending that stuff back with a list of things that need to be corrected in the application before the committee, and then the committee will review that again. So that's something that's going to come in the future. But just as a side note, we've had a lot of agencies call us, come in, talk to us about expanding territory, starting up new ambulance corps and stuff like that. So I don't know if it's going to happen, but right now we have at least 4 other agencies that we're talking to about that. And then we also have a bunch of agencies that are looking to upgrade to ALS. So there's a whole complexion change that's going on in our area right now. I don't know how it's going to come out. Some of them were very surprised at what they have to do to get a CON to operate, but some of them are very interested in it. So we'll see what happens from there. Kingston Fire went live for an ALS upgrade paramedic in January of this year. We approved that back in last year in the REMAC. Spring Hill Ambulance Corps has been approved to go ALS upgrade, but due to some equipment delays, they haven't done that yet. I believe March is still their date, sometime in April 1st. Okay, the end of March. And we got Beacon Volunteers also looking to be upgraded, has been upgraded to an AEMT level, but they have not gone in service yet with that, correct?
No, not yet, no.
Okay.
The state inspection is actually Friday at 9 a.m.
Okay, good. So we're close on all of those. IGEL project is ongoing. Right now, we have 152 agencies statewide that are participating in it. 93 of them have completely trained all of their people. We have about 1,200 EMTs trained, and we're thinking about 300 insertions have been recorded. Data's still an issue. Jeff is working with Alex Blue on that almost every day to try to solve some of the problems. We've found some pretty big stuff that has helped us, record the insertions. I just got a message from Long Island, Suffolk County, that a lot of their agencies, and I think they have over 100, are really interested in it, and she's been starting to process them. So I assume that we will have quite a few from there. We still have another year left on the project, so it's worth getting the extra data in there so that we can really put out good statistics on it. This meeting was set up in Boardable, so everybody who didn't get a response or didn't get a message, let us know. I have those, you two gentlemen, but if anybody else, we'll work with you, Kelly, on that. But anybody else has a problem or question, let us know, and we'll do what we can. And we have some assistance at the state level that we can call upon. HVREMSCO and CMAC is going to be May 6th, 7th, and 8th. I always say 6th, 7th, and 8th because the the program agencies meet the day before the actual meeting that's up there. So I always look at it as a 3-day meeting instead of 2 days like some people. The REMAC is scheduled for March 4th, and we haven't had anything scheduled on the RTAC yet. I haven't seen anything come in on that one.
Isn't it the end of March,
They said the end of March, but there hasn't been a set date as to when it is, as far as I know.
Well, I have a thing for March 29th at Kingston Hospital. In fact, I just looked at the thing today to wrap up my travel order.
Okay.
Same date.
March 29th then? Okay. I must have missed that one then.
Well, since I'm the EMS liaison for Health Alliance, let me
Clarify all
clarify that.
Yeah, Kingston.
9:30 in our auditorium at Health Alliance in Kingston on March 29th.
Okay.
Is the RTAC.
Okay, good. So if anybody's interested, that would be the time. The EMS Memorial dedication on the Empire Plaza will be May 22nd, 2024 at 11 a.m. I do have a flyer on that one, I think, yes. We do have one person from the Hudson Valley, Lisa Schuerman, I believe is the way you say it? Sherman, out of Goshen Volunteer Ambulance Corps, who passed away on May 13th, 2018. Vital Signs is going to be October 16th to the 20th in Rochester. The other thing I just got today, just a few minutes ago before we came into the meeting, is the Honorable but Broken EMS in Crisis film. It's March 7th, 2024, Thursday at 1 p.m. at the City of Kingston Council Chambers. And you have an email if you want to go see that there. You have an email that you have to respond to, which I will put up on the Boardable also.
That'll be going out to we just got that confirmed today, or the announcement just came out today. And I will send that out to my listserv for the, we call it the Westchester, the North region. Kingston, Poughkeepsie, we'll get that out, so that'll be, you'll start seeing flyers for that.
Excellent. Awards. We sent out a message that was forwarded from Ryan Greenberg saying that awards will be on their website and sent out directly to the regions. Well, that isn't ready yet, so you can submit them to your county, and then the county can submit it to us, or we can wait a little bit. And they said today on the meeting that they should be ready very shortly. The software is ready to go. They're just testing it, so hopefully we'll see that very shortly. So if you want to wait until then, that's fine.
Do you know, Bill, is that gonna be up year-round so people can submit throughout the year?
I believe it will be. It sounded that way when he first talked about it, but we have to see what actually happens.
And we'll be able to, like culminate from the county level, then the regional level?
Well, everything that goes in that portal will go to the state, or will go to the region that it's filled out for, except for the innovative awards. Innovative awards will automatically go to the state. But yeah, we'll have all of that. We should have all of them. I mean, I'm not sure what kind of quantity that's gonna be. It's gonna be an interesting task when it does come down.
What we're waiting on, Desiree, is kind of like how they're gonna work that, because technically they're supposed to be voted on at the county council first. They have their winners, and then the county council sends it to the region, we send it to the state. So if the state's sending it, and it comes back to the council, then we are obligated to figure out how do we get it back to Orange County, or Rockland County, or Ulster County, back for them to, because they won't know if it's going straight into the portal. So, work in progress, great idea.
That's all that I had.
All right, any questions for Bill? While he was talking, I was playing Unboardable, just to kind of show you guys, for those of you that haven't had an opportunity to get in there. But when you look, you can see those of you that had the opportunity to acknowledge it, we can see that. Equally, some of your colleagues put no in there, they can't attend. So it becomes a great tool for us in the office to be able to know, are we close to having a forum? Are we way over having a forum? We don't have to send these, I mean, correct me if I'm wrong, nobody wants one extra email of, can you please respond? Right? So it's just a nice, easy way when you acknowledge in through here, you know, again, everybody that's RSVP'd through, and then just coming back on some of the documents that are in there. You know, those things are all uploaded in there. So there's all kinds of data and stuff that we're putting in, you know, for you guys to be able to see, access, all this stuff. That's where we're gonna load it. Fax machines are unfortunately antiquated and nobody wants to use them. Emails are overloaded. So this just becomes a centralized deposit for all of that stuff. Go ahead, Andy.
So I actually clicked that link, 221, 224, there's nothing in there. I actually had to go to groups and find it that way.
So sometimes when you go in just that way, it's shutting you down for coming in. So you noticed that when I backed up to go to that folders for documents, you only see 2 folders in there. But when I back out and clicked on the Hudson Valley, right? So I come into the meeting and I simply click on it. Everything is coming through. And then in the documents, there should be a ton of stuff in there.
Click that, go ahead.
Here?
Yeah. Nothing.
Okay, so.
I went to groups and then clicked the meeting, which is a different, I'm sorry, clicked Hudson Valley group. And then, documents, and then file. Then I get a different file, different folders, yeah.
Correct, and all the stuff, like I just uploaded while we were talking, Rich Parrish's reports are up in there.
Yeah, but that's in a different space than the meeting thing.
Poke around,
Okay.
have some fun. All right?
It took me a while.
So again, while Bill was giving his report, I uploaded Rich's report in there, because I had it all electronically, so. All right, let's keep this spinning, guy. Jeff Crutcher, UI report, please.
Okay,
Oh, hang on a minute, I apologize.
Dealing
John.
with that for non-members, and we've discussed it.
Yeah, did we ever get an answer on adding people?
I'll check with Brian.
Okay.
He never.
You did ask that question last meeting.
More than once.
If you don't ask, we can't help.
More than once, yeah, absolutely.
It's a legitimate question
Yeah.
that we legitimately didn't answer. So all I can do is apologize. Checks in the mail.
That's the purpose of coming.
No, I got it. No, you're absolutely right, and we have to go back and figure that out.
Yeah, I asked him, but he has not responded.
Right. Okay, Jeff, please.
Okay, the move to NEMSIS 3.5 has to be done by the 1st of July. When your agency feels they're ready, contact your vendor, tell them to switch you over to 3.5. Unless you have ZOL or EMS charts. And then, for whatever reason, Peter wants a new DOH 5136. He didn't elaborate as to why. 3.5 should solve some of the issues. partly because the schematron is going to be so much smaller. But it's also going to be outcome-based, so that depending on if your call was a transport, it's only going to pop up those screens that are appropriate. It should streamline the procedure for the end user. In theory, we should be getting better data. That being said, we have found issues with iGel. And one of the issues is the procedure code that is used. And procedure codes do not come from NEMSIS, they come from SNOMED, which is another standardization industry, basically. So Alex and I did some poking around on Friday, and we found out why a lot of our Sansio agencies were submitting Drupals saying, here, we did one, and here's a copy of the redacted chart, but it wasn't showing up on the state report because they're not using the right procedure code, which leads to potentially bigger problems because we're finding charts that are flagged as an iGel chart. They're not. They're straight intubation. So we have to go in and at some point in time figure out if the procedures that are being entered by the provider are actually the right procedure codes at the very end. And this is not just affecting iGel, this is affecting every procedure that you do. And it's something that obviously didn't get caught in the first couple of years of 3.4, and it's only because we're doing this pilot study that we're finding it out now. A lot of it, I'm afraid, is going to translate into 3.5, but now that we know there's an issue and we've been able to substantiate it with the state, mindful that we were submitting these issues 8-9 months ago, showing them examples, screenshots, and everything else, and now they're finally catching on to the fact that there's a problem. At some point in time, hopefully it gets fixed.
Are they working with the vendors that?
As a matter of fact, they are. During our meeting last week with the larger iGel group with data and informatics, they actually sent a questionnaire out to the vendors right then, and 3 vendors responded back. So 3 down, 14 to go.
You know which vendors?
Offhand, I don't remember. That was a week ago that I saw the email. Tim?
What I was gonna say is that I've spoken to colleagues around the state about this exact issue over the past year and a half or so. And there are people around the state who are creating procedures intentionally not using SNOMED to avoid all of the required fields. Because if you create it as a generic intervention, you don't have to do that.
Right.
And, you know, I'll say it, there's legitimate reasons why they would want to do that, and I totally get it. But I also see your point, because then it's not going to show up when you're trying to do these studies. So the, you know, the right balance there is going to be cutting by 75%, which is what's going on with 3.4 to 3.5, the number of NEMSIS fields, so that you don't have to deal with those onerous requirements that the state has put on us.
And
because they're creating their own problems.
No disagreement with that. Yeah. But if you're an agency and you're looking at first pass success for ET, are you getting all the data?
Well,
from the agency, you should be, because you should be doing it internally.
Right, at the agency level, yes, but when you're trying to compile that into a larger data set,
you're not getting it.
You're not getting it, or the state isn't getting it, or the region isn't getting it, or anybody looking at the data isn't getting it.
So when we look past that and we look what they're trying to do with biospatial and give us real-time data,
yeah.
It's going to be real-time, but it's not going to be accurate.
Right.
Now, the data that we look at, we have 271 confirmed iGels, and that's confirmed with charts. Whether I glean those charts from the State Bridge, our regional site, or the ESO umbrella that we have, or redacted charts that are sent by agencies. So we can be confident with 100% of the data that I have for those 271 calls is accurate. But we still don't know what we're missing.
Right, I think the state blew it with 3-4, quite frankly. And you know, I had lunch with Mike Daly up at the State Council a couple weeks ago, and a couple other people from around the state. We were talking about this very thing. And as Glenn just said, garbage in, garbage out.
Yeah.
And they're creating their own problems by putting these ridiculous requirements on each of the agencies to force the data. And you can't force the data because, you know, either they're not gonna use it, either the providers are not gonna use interventions at all, or they're gonna force agencies to create generic interventions so that at least at the agency level, they can catch first pass intubations or number of IV attempts, or whatever the case may be. In particular, airway interventions was the biggest problem, but I've heard
Right.
about a lot.
But the whole purpose of NEMSIS is to be able to use that repository to do research.
Right, exactly.
And if we're putting
It's the whole
poor
point.
data into that, it's worthless.
And NHTSA's not getting good data.
No.
You know, so, but you know, far be it for me to defend the state, but in the state's defense, they have Peter and they have Alex.
Yeah.
That's it. They don't have anybody else.
And they're about to
cracking
lose
the code
Alex.
with it, huh?
And they're about to lose Alex.
And they're about to lose Alex, he's going to medical school. So, you know, I'm sure they'll come up with a couple of interns to replace him or something. They always do, and they do a good job with that, but they don't have a lot of people either. And they're managing, as you pointed out, Jeff, 17 different EPCR vendors. That's not an exaggeration, there are 17 vendors across the state. It's nuts.
And so the only thing that I want to just kind of input here, and for those of you that attended the state meetings, you heard it about a dozen times, but you need to take this information back to your local councils and to your agencies. The state said it no less than a dozen times.
June 30th.
This 3.5 change is an agency responsibility. You cannot pass it off to your vendor. They have warned you 100 times, it's coming. It's your job as an agency to make sure that your vendor data is going in. Because if it's not, they're holding the agency accountable, not the vendor.
With SOPs.
And they said that, no, am I exaggerating a dozen
Not at
times?
all. At least 8, 10, 12 times, they said,
Right.
over and over and over.
So make sure you're taking that back to your agencies.
Yep, in every committee meeting, it's seen that.
Put their vendors to the grill and make sure that they're doing what they're contracted to do with your agencies.
Yeah.
So, anything else, Jeff?
No, that's it.
Any questions for Jeff? Thank you, great report. All right, we're gonna move over to committee reports. I don't believe, did David put a training committee report in?
No.
I know they met yesterday, so he probably hasn't time to type it up. I'm gonna jump right over to the state HVREMSCO CMAC policy. It's here. I'll be happy to read it if you'd like. Or it's already onboardable. Okay, it's uploaded. Please go read it. Okay, if you have any questions, please send them back in an email. We'll be happy to clarify it and answer it. But in a preservation of your time and in future moving forward, these things will be here before this meeting so that you can read them and review them and then come with questions instead of wasting your time of trying to do that. So that's all up through there. As far as REMAC, unfortunately, Dr. Papish could not be here tonight. The protocol committee, I don't think there was anything that came out of there. The one thing that did change, so most of you are aware, Michael Beninati from LaGrange Fire, who has served as the chair of the protocol committee for several years now and did a phenomenal job of not only running our protocol committee, but essentially steering New York State into where we're at today. And he fundamentally changed the direction of the state EMS. Single-handedly, with a whole lot of help, changed the direction. Recently, as he was retiring, Bill and Karen and myself, Dave Violante and Dr. Murphy met for lunch and took him out. And Dr. Murphy, on behalf of REMAC, decided that as a gift, and we're going to have this framed, not only to hang here, but also give to Michael. But we decided, because he is, if you know Michael at all, he's not an awards kind of guy or take the accolades. He's just here to do a job and get it done and make sure that he leaves it better than when he started. So Dr. Murphy decided that as a tribute, she purchased for him. As a living tribute, 25 trees will be planted in our nation's forest in honor of Michael Beninati. All right, this is a lasting memory of how hard you have worked for the pre-hospital community and fellow frontline providers from the Hudson Valley REMSCO, and then it's listed on here. So we will have this framed, given to Michael. We're going to have a copy of it made and hang here inside the office. So we felt that that was something that, and he was taken back. He knows about this. He just hasn't seen the flyer yet. So that's what we did. We did meet with Michael's input, Dr. Murphy and myself, and there is been a new appointment to the protocol committee. Mr. Robert Zealy, who has served on the protocol committee for several years, will take over as the chair, effective immediately. So you will start seeing that as it comes through. So please let's welcome him to there. Dr. Papish didn't give us a helicopter report. Steve, is there anything you want to throw out since you do that pretty often?
We can share the data findings. I'll shoot that over by email so the group can see it. No incidents.
You can load it right up on Boardable when we get you some access to it. When we get you some access to it. But if you send it to one of us, we'll upload it for you. And then we can all get that. All right, great. Thanks, appreciate it. Glenn, did your committee have anything else other than your action you brought up?
We're just working on that BLS agency in Rockland, but again, it's a lot of work that's got to get done on it, so before we can, get stuff back. We're going to get stuff back to the person.
Beautiful. Public Information and Education Committee still needs a chair, as well as the Policies and Procedures Committee. We'll kind of get that in there, and we'll get these other two committees up and running here in a short piece. That brings us up to Legislative and Bylaws. Mr. Bachman isn't here, and his co-chair, I believe, is Mr. Egan.
What do you want to do first? Let's do the bylaws first.
Let's do the bylaws first.
Okay.
The bylaw
So,
change.
This has been sitting on the floor for at least the past 30 days, definitely since.
It was at the December meeting, so it's been longer than 30 days.
Much longer than 30 days. So, just to recap, there's a bylaws change to section 6B regarding quorum. The present bylaw reads, each member shall be entitled to cast one vote. No absentee or proxy vote shall be honored. The majority of votes cast shall be required to decide any issues unless specifically stated otherwise in the bylaws. The proposed bylaw change reads as follows. Each member shall be entitled to cast one vote. No absentee or proxy vote shall be honored. The affirmative vote of a majority of those members present shall be required to carry the motion of any item brought before the regional council. That's the change of the last sentence.
Does all that make sense?
So
Questions and concerns?
Motion to accept or pass, whatever you want to do.
All right, well, we have to take a vote. It was already, bylaw has been up, there's no changes or amendments to it. So then we're just gonna need a roll call vote to change our bylaws, so, please.
Okay. Dutchess County, Chrissy Amy? Oops, sorry. I'm reading from the wrong one. My son. Anthony Sang?
Yes.
Yes. Stephen Scully Beeman?
Yes.
Michael Biggs from Orange County?
Sure, yes.
David Grass?
Yes.
Israel Nalblad?
Yes.
Nancy Pfeiffer?
Yes.
Putnam County, Robert Como?
Yes.
David Jacobson?
Yes.
Steve Wygan, I vote yes. Rockland County, Bernice Garati? Nick Rizicki?
Yes.
Am I saying your last name right?
Close enough.
Okay. Tim Egan?
Yes.
Desiree Leon?
Yes.
Glenn Albin?
Yes.
Sullivan County, Alex Rowe?
Yes.
Neil Meadow? And Ulster County, Kelly Nelson?
Yes.
That's it. The yeses have it.
All right, we passed this, thank you very much. That'll be adopted in our bylaws. We'll get that reprinted, and what we will do is put a copy of our bylaws up on Boardable, so that anytime somebody wants to view it, as long as you have access into it. We'll work on it, Mike and Steve and Kelly. This way you have access to it and you know exactly what it is. It's not a secret. What's that? I'm sorry?
I'm sensing a theme here this whole board. So,
When Waterville collapses, we'll have issues.
Then you can blame me.
We have hard
all right,
times.
so as far as ledge is concerned, Glenn just spoke, so his name is on it. Albie and I spoke about this recently.
Okay.
With regard to the legislative breakfast that we've been discussing.
Mhm.
So he reached out and met with Assemblywoman Eileen Gunther, who he's pretty close with up in Sullivan County, and she's been a friend to EMS. She used to be a nurse years ago, still is a nurse. She's been a friend to EMS for many, many years. We spent a lot of time speaking with her about different EMS-related legislation. And he had a conversation with her, and her opinion is that we should wait at least until the third round of budget talks in June before we move forward with anything, and that we should then set our legislative, or not a legislative agenda, but our talking points, and then hold a breakfast either in September or October. Honestly, I thought that was a little late in the season, but that's what the Assemblywoman suggested that we do. So with that said, we're going to continue to work on this.
Okay.
And you know, obviously, it's gonna take a little time anyway. She feels that we really should wait to see how the governor's budget, the executive budget aligns with the one House bills and what's gonna happen moving forward in terms of, you know, a projected status of this. He also had checked on locations. He's looking at about 45 to 60 ahead, and that we're gonna have to come up with some donations to cover the costs of this, because obviously there's no budget associated with it from the council. So we're gonna work on that and try and figure out a way in which to cover the expenses of this.
Excellent.
But we definitely wanna do this, because it was pretty successful the last time we did it.
Agreed.
At least 5 or 6 years ago.
We did it right around the corner.
Yeah, right down the street,
Right.
yeah. So that's it. That's all I have.
Any questions for Tim? Thank you, appreciate it. Anything you want to add on community paramedicine updates?
Other than, you know, with regard to the governor's executive budget, we're carefully watching what's happening with all of this legislation. You know, we all know about the bill that was passed into law, and also as this relates to Austin and Scarback, with regard to their expansion of territories in Westchester County, because 90% of their applications were about community paramedicine, so they'll be able to continue to do that now throughout the rest of the county instead of just in their service areas. But again, it's under that pilot program that was passed under the law. So there still needs to be legislation with regard to that. And there is verbiage in the governor's executive budget with regard to CP, along with many other things. But you know, we have to wait to see how this is all going to shake out. You know, one thing I can say, one thing I will say, is that this is the third year in a row that the governor has strongly considered EMS in her executive budget. And that's not happened in my legislative career, if you will, with regard to lobbying on behalf of EMS. And I've never seen that happen before. It was Part F, then it was Part S, or was it Part S and then F? Oh, whichever it was. Now it's Part V, but she's still strongly considering healthcare and in particular EMS in her executive budget. And sooner or later, the stars are gonna align and we're gonna get what we need in terms of legislation. So I think, you know, we got direct pay last year. I think we're in good shape to get something done this year. So more to come.
Weren't we worried about direct pay with regards to the insurance companies trying to fight it, that they had
Of course.
a year or two to,
Of course.
to amend it or do something?
Well, a year,
to it?
because it's scheduled to go into effect January 1 of '25. So they have this legislative year in which to block it in some way or appeal. Or actually, what we're expecting them to do is change it in terms of
With
what
your
is
ear to the-
usual and customary.
With your ear to the grapevine, have you heard anything that's?
No, however, it's a little early in the season. But what we think they're going to try and do, if they do anything, is change what usual and customary actually means and try and tie that to Medicaid, so they'll get what they were looking for in the first place, right? But you know, we're the flavor of the month in all this. EMS is you know, everybody wants to get up next to EMS. If you've been to any of the press conferences or, you know, listened to any of the commentary with regard to EMS legislation this year, EMS is where it's at this year, and all of the legislators are you know, sidling up to EMS and want to get next to them and want to be seen with them and want to hear them. And so if there's going to be a challenge to direct pay legislation that was signed into law last year, it may not be as strong of a challenge as it initially was suspected it might be. We don't know. I mean, again, it's too early to tell. But there's a lot of other stuff happening. And, we're popular. We're the popular kids this year, so we'll see.
Just to kind of expand on that just a little bit, if you're not on the leadership meetings that happen once a month from Ryan Greenberg and his team, he spent a significant part of this leadership meeting really deep diving what a lot of the Part V changes that's in the proposed budget would do in effect, because there's people that are nervous about some of the language that's in there. You know, how's it going to affect them or their region or those areas? And I thought he did a pretty good job of explaining himself. Whether you agreed or disagreed with what he was saying, he did a fairly good job of explaining his position. So if you haven't seen that, I would encourage you, when you see them posted or coming out, jump on there. If you are not part of the EMS leadership, then get an email out to
Didn't we get an
Peter
email?
Brody to get yourself added to those emails as they come out once a month and be on those agendas.
Yeah. Didn't we get an email for tomorrow at 5 o'clock?
Oh, is there another one coming out tomorrow?
Yeah, tomorrow's our budget.
Yeah, no, go ahead.
Yeah, part 5 budget, yeah.
Yeah.
Right, so he
That's
did his that presentation, he did as part of the leadership
Yes.
meeting too. He's bringing them out. So again, I would encourage you, if you have questions, how is it gonna affect me or my region or my county or my agency, you know,
He is
listen to them.
receptive to input. I can tell you that he reached out to me about a month ago on a Saturday about all of this. And he did a pop in, so what we've been doing is scheduling our onion meetings on the Monday before state council, because we're all gonna be there already anyway, so it's getting good attendance and getting good input and content. And he did a pop in at our onion meeting that Monday night. And one of the things that was suggested to him with regard to the 80 paramedics that they're gonna take in for their task force, because that's concerning the ALS agencies across the state, or where these paramedics are gonna come from. They're gonna come from existing agencies, right?
Right.
But what was suggested to him was, why don't you use some of that excess training money, because they keep talking about, what is it, $2 million that hasn't been spent yet? Take some of that $2 million and run some courses for paramedics to do a one-for-one replacement for anybody that you're putting on the task force. And that was suggested to him, and he stood there in the door and was like, that's a great idea. He brought it up at CMAC, he brought it up at HVREMSCO, he brought it up during LEDGE, he brought it up during other meetings. And he is strongly considering doing that and trying to get that pushed through. So he will take input, he is listening to people, and, you know, I gotta say, I'll grudgingly say that I think he's trying to make the system better. In his own vision, but he's trying to make the system better, he's trying to do a job.
I think this budget cycle, he's done a better job of explaining his
Yes.
position.
And
Whether
it's
you
learned
agree
from
with it or
previous
disagree
years.
with it, he's done a really good job of explaining why why they're doing what they're doing,
He's
which
been beat over the head with
I give him
a
credit
couple
for.
times over
Yeah.
not doing that, and then he's learned from that, so.
Okay.
In the evidence-based document that created the state, there was a solution 16 and 17. One was develop a state subsidy or grant program to provide financial relief for EMS agencies to improve or meet quality response metrics, and 17 was fund a $36 million EMS sustainability grant program, distributing $2 million to each HVREMSCO. Where's that?
So remember that in that sustainability tag, that was a list of suggestions that nearly 40 really smart people came up with and
Yeah.
said, here is our recommendations. In full honest disclosure, when it comes to the state, there's no way they're gonna tackle all of those at once. So part of last year's budget tackled some of those. They're in legislation, they're moving forward with it now. In this Part V, more of those suggestions are in there. We anticipate, to Tim's point, that next year, more of those recommendations will be in the proposed budget to bring the finances to support that stuff.
Okay, so not yet.
If nobody's told you, the state says they're broke. So we have to find where this money's coming from. But to Tim's point, you know, we've really been lucky in the last 3 years. We are seeing more forward progress coming out of our legislators and the governor than we've seen in the last 20 years combined. So we're not looking to gift horse in the mouth, we're looking to literally steer this cart with this big Clydesdale we've been given.
I've heard her speak privately in smaller groups, and she is really gung-ho about trying to help healthcare in general.
We're on a good roll. Let's hopefully that we can keep steering it down. Okay, so as far as the State EMS Council, as I said to you before, I'm not going to read verbatim Mr. Violante's report. It is up on Boardable and there. As far as old business, is Brenda or Wayne here?
No.
I don't see either one of them, so we'll go from there. We've already taken care of the bylaw change. We already took care of the Carmel expansion. I skipped right over Deseret. So let's go back to Deseret.
Just a reminder to get your county awards in so we can get them to the region on time. If the portal comes about, that'll be a great addition, something a little bit easier to streamline everything, but it's very difficult the way we've been receiving them over the last several years. People don't use the form that's provided, people attach letters of recommendation but don't fill out the form questions. So just remind the folks in your counties just to use the form that's available until the portal becomes available. Answer the questions as they're presented, it's just 3 paragraphs, the demographics on the front, and send that in. If we don't have a representative, we'll go through the list, make sure we have a representative from every county on the committee, so when we evaluate them, that every county is represented. So if I don't have somebody from a particular county, I'll be reaching out to that county to get a volunteer.
Voluntold.
Voluntold, there we go.
When are the awards, what's the deadline?
You know what, I left my,
Close the business Friday.
I know they have to be into the state by May, so.
yeah,
We're usually a month before that,
Yeah.
so sometime in April, I would guess.
yeah, it's not until,
Usually it was around April.
I was gonna say April 1 or something like that.
As soon as possible, please. We'll get the deadline to you. Because I know we have to have them up in May. I don't remember the exact day in May, because then they need, you know, a couple of months to go through the whole state's, you know, all 18 regions nominations and then come back up for it.
They don't have anything about it on the state website yet.
No, it doesn't surprise me.
Because I checked.
And that's because there's, again, for those of you that don't have the privilege of attending these state council meetings, I would encourage you to at least go once, just to see some of the excitement that goes on up there. And I say
Excitement or
that
shenanigans?
with a smile on my face.
Way to try and
Pam, you had the
Excitement or shenanigans?
the privilege of being there at the last one, so, you know, she can attest to how much fun it is to watch a bunch of grown people, you know, talk about something until the horse is not even putting out dust anymore, but we talk about it. So that's it. I had a couple of things that we did have to bring up before I open it up to any other new business. So number one of the things that we're looking for Glenn's committee is a little more diversity. It doesn't look like, and Glenn, you correct me if my information's wrong, but there's nobody from Orange, Ulster, or Dutchess counties on the transportation committee. Okay, so there's one Orange, all right, Ulster or Dutchess. So we're looking for, because again, as the transportation committee is making their decisions, we want to make sure that every county is represented on that. You know, those are significant. They're transfer of authorities and there's CON expansion. So every county should have a representation there.
I'll Dutch or something.
Okay, send an email or something, because you'll say it, I'll nod it, and then totally forget about it. You know, hence John not getting on boardable. So, the last thing that I wanted to bring up, we did send out the meetings for 2024, and unfortunately we realized that the date that we had picked in September is coinciding with HVREMSCO. So there are several of us that will not be here for a regional council meeting because we'll be in HVREMSCO. So what we need to do is pick another date. I wanted to do it while we were in council so that we were making sure that we weren't picking a date that was going to conflict with any religious or national holidays that anybody celebrates. So get your calendars out and tell me what day will work.
So sounds good, couldn't reschedule that?
What's that?
Sounds good, couldn't reschedule that?
Yes, the state could reschedule it, but, you know, that would take like 17
That would take an act of
approvals
God.
and,
Take an act
you know,
of
we
God.
won't get there, so we will have to reschedule. So, and we didn't want to pick a date without making sure that we weren't being cognitive of everybody's,
Second week in September, the 9th or 10th?
Either a week
Sure.
before or a week after.
Sure.
They're both fine.
Probably after.
September 11th.
Yeah, I would, if both of those are okay for everybody, I would say the Wednesday after state council, so that we can bring that information and disseminate it back to you. That would be my suggestion, as long as it doesn't conflict with anybody's
What they
All
would do.
good?
needs. So what would it be, September,
25th.
25th.
so we go to September 25 for the meeting?
Looks good to me.
Everybody's good with that, no conflicts?
Dutchess EMS Council.
Dutch CMS council meetings that night. That's gonna create a problem for them.
And Orange County is the night before.
September 3rd
Okay,
is my
we meet,
birthday.
yeah, Orange County meets on Tuesdays. So the Wednesday before, because state council is always the first Monday, Tuesday of the month, right?
Yeah, I think we had this problem once before, where I guess we had to move it to the week before, we just didn't get the state council stuff, that's all.
We can do that.
Week before September 11.
Yeah, it is
Right.
September 11th.
I think we had state council on September 11th this past year, didn't we?
Yeah, we had
Yes.
one year, I'm not sure if it was this year, but we did have one year.
Guys, that's why we're here discussing it, so that we don't inadvertently pick a date and then somebody go, yeah, you didn't think about this.
You wanna do it the day after the state council?
The night of the state meeting, you talking?
No,
No, I was
the
gonna
day
say,
after.
no, absolutely way.
That would
So
be
then we would
Thursday.
be on a Thursday?
Yeah.
Thursday gonna create a problem for anybody?
Thursday at 19.
Would we have enough paper? Would David,
What?
I don't know if David would have enough time to get his report done.
I don't know if we'd have enough time to get the reports done. I mean, we could go verbal from handwritten notes, then we've taken boardable and thrown it to the wind.
We'll check portable after, don't
All right, so let me ask this question.
Let's not have that.
What if we went to the first Wednesday in October?
So I was thinking the second.
That's
I won't be.
Rosh Hashanah.
That's why we have these conversations. Second Wednesday in October.
No, that's fine. That's the 9th.
Second Wednesday in October, October 9th. Any conflicts that anybody can see inside their calendars? Holidays?
I don't see.
It's a long time ago.
All right.
Without him.
And then we go to, well, we'll have a meeting in May, then we'll go to October, and then we're back in December. So it'll be a short burst between there.
Yeah, and a long burst between them.
Yeah,
That's-
are you
that's-
expecting
yeah.
applications in for CONs that you have to act on? That's a long
That's
gap.
why we're having these conversations, people.
Well, it's just the end of
Y'all
August.
smart people. That's why we're discussing it.
The last Wednesday. in
Okay,
August.
let me ask this question. Is there anybody feel that we would be disrespectful on meeting on September 11th?
Fine with me, as long as we say a little prayer. or
I don't
something.
know what your communities do as far as 9/11
Yeah,
memorial.
That's a good point, there's a lot of ceremonies.
Yeah, I've always done a
Yeah, that's
ceremony
true.
in my community that night.
So that would be wrong.
Yeah, as a matter of fact, I missed something locally, could be a state council device.
Okay.
What about the 12th? September 12th, it's a Thursday.
September 12th work for everybody.
So my question is, if you're doing the 12th, can we do the 26th, which would be after the council?
September 26th, a Thursday.
Yeah.
That'll be after the Dutchess council.
Does anybody see any conflicts with the 26th? See, this is why we do this, guys. We're a bunch of smart people. We'll figure this out.
I mean, if you want.
Thursday, the 26th, could we do it?
That sounds good.
Is there anybody that sees a conflict with Thursday, September 26th?
Can we just vote on boardable?
We're gonna fix this right now, because we're gonna post it on Boardable. Is there anybody that sees a conflict? Booked.
All right.
Secretary, you'll make sure that that's in the minutes. We'll get that up on Boardable announcing it. September 26th, a Thursday night, we will move the council meeting. Because it is a public meeting, so we do have to have it posted long enough where the public can come in. All right, last thing that I have. It's hard to believe, but we're there already. Nominations for office of the council.
Use the bathroom.
So, yes, the next time we meet is May. May is when we vote on them. So, if anybody would like to run for president, vice president, secretary, or treasurer, you should put in a email to Joan as soon as possible.
Bobby Poland used to do that. What? He used to be nominated.
Bob doesn't want to take it over anymore, he says. Joan Siebert is the chair of the nominating committee.
That's fine with me.
So if you could send that stuff to her ASAP, so that the nominating committee can review everybody that's applying, and then we will move into September, in May, we'll be back to vote on the new members. That's where it gets kind of screwed up. Because we technically should have announced this in December so that you could make your nominations tonight. Okay? But just get to nominations.
They can
to
nominate
Joan.
from the floor at the meeting, right?
At the meeting, nominations from the floor can come up, and President is more than welcome. You can have it if you want. All right, that's everything that I have. Does anybody else have anything else for new business?
Motion to adjourn.
Hearing nothing, I have a motion to adjourn from Glenn, seconded by about half the room, but we'll take Michael Big. And have a great evening, guys. Thank you very much.